Urinary tract infections (UTIs) in children are relatively common, particularly in infants and toddlers. UTIs occur when bacteria enter the urinary system, which includes the kidneys, bladder, ureters, and urethra. In children, UTIs can be more difficult to recognize than in adults because young children may not be able to communicate their symptoms clearly. Prompt diagnosis and treatment are essential to prevent complications, such as kidney damage. Types of urinary tract infections in children. Cystitis bladder infection involves an infection in the bladder and is the most common type of UTI in children. Symptoms often include discomfort or pain during urination, frequent urination, and sometimes blood in the urine. Pyelonephritis kidney infection. This is a more serious UTI that affects the kidneys and can cause high fever, back pain, and nausea or vomiting. Pyelonephritis requires urgent medical treatment, as untreated kidney infections can lead to permanent kidney damage. Urethritis urethra infection. An infection of the urethra, typically caused by bacteria entering from the anus or genital areas. Asymptomatic bacteriuria. In some children, bacteria may be present in the urine without causing symptoms. However, this can still be a concern, especially in infants, young children, or those with underlying conditions. Causes and risk factors of UTIs in children. UTIs in children are typically caused by bacteria that enter the urinary tract. The most common bacteria responsible for UTIs in children are Escherichia coli E. coli, which are normally found in the intestines. Other bacteria, like Klebsiella, Enterococcus, or Proteus, can also cause infections. Several factors increase the risk of UTIs in children. Anatomical abnormalities. Structural problems in the urinary tract, such as vesicoureteral reflux (VUR), a condition where urine flows backward from the bladder to the kidneys, can increase the risk of UTIs. Constipation. Chronic constipation can put pressure on the bladder and prevent it from fully emptying, which may allow bacteria to grow. Poor hygiene. Inadequate cleaning after using the toilet, such as wiping from back to front in girls, can introduce bacteria into the urethra. Female gender. Girls are more likely than boys to develop UTIs, primarily because of their shorter urethra, which allows bacteria to travel more easily to the bladder. Uncircumcised boys. Uncircumcised boys are at higher risk for UTIs, as the foreskin can harbor bacteria. Urinary catheters. Children who require urinary catheters or have a history of catheterization are at an increased risk of UTIs. Underlying conditions. Children with certain conditions like diabetes, immune system deficiencies, or neurological conditions affecting bladder control are more prone to UTIs. Dehydration. Not drinking enough fluids can reduce the frequency of urination, which may prevent bacteria from being flushed out of the bladder. Symptoms of UTIs in children. The symptoms of UTIs in children depend on the child's age and whether the infection affects the bladder or kidneys. Since young children may not be able to verbalize their discomfort, it is important to look for signs of a UTI. In infants and toddlers, fever without an obvious cause, irritability or fussiness, poor feeding or vomiting, strong smelling urine, diarrhea, abdominal pain, dehydration, dry mouth, fewer wet diapers in older children. Pain or burning during urination, frequent urination or a strong urge to urinate, blood in the urine, hematuria, pain in the lower abdomen or pelvic area, fever often with kidney infections, cloudy or foul-smelling urine, bedwetting or increased urgency, especially if it's new or unusual. In more severe cases, kidney infections. High fever, often above 102 degrees F or 38.9 degrees C. Pain in the back or side flank, pain, nausea or vomiting, poor appetite, lethargy or tiredness. Diagnosis of UTI in children. When a UTI is suspected, a healthcare provider will typically take the following steps. Medical history and symptoms review. The doctor will ask about the child's symptoms, past medical history, any recent illnesses, or toilet habits. Urine sample. A urine sample is the most important test for diagnosing the UTI. The sample is tested for the presence of bacteria, white blood cells which indicate infection, and red blood cells which may suggest bleeding. A urinalysis is the first test, and if bacteria are found, a urine culture may be performed to identify the specific bacteria causing the infection. Imaging. If the child has recurrent UTIs or if there are concerns about anatomical abnormalities, imaging tests like an ultrasound or avoiding cystourethrogram (CUG) may be recommended to check for issues like vesicoureteral reflux or kidney damage. Blood tests. In cases of kidney infections or severe UTIs, blood tests may be needed to check for signs of infection in the bloodstream. Treatment of UTIs in children. The treatment for UTIs in children typically involves antibiotics to eliminate the bacteria causing the infection. The specific antibiotic prescribed depends on the type of bacteria identified and the child's age, health status, and the severity of the infection. Antibiotics. Common antibiotics used to treat UTIs in children include amoxicillin, trimethoprim/sulfamethoxazole, cephalosporins like cefalexin, nitrofurandiins or lower UTIs for kidney infections, pyelonephritis. Stronger antibiotics may be needed, often given intravenously in a hospital setting. Pain relief. Pain relievers, such as acetaminophen, Tylenol or ibuprofen, can be used to reduce fever and discomfort. Hydration. Keeping the child well hydrated helps flush bacteria from the urinary system. Encouraging the child to drink fluids can speed up recovery. Hospitalization. If the child has a severe kidney infection, is unable to keep fluids down, or is very young, they may need to be hospitalized to receive intravenous antibiotics and fluids. Prevention of UTIs in children. Several strategies can help reduce the risk of UTIs in children. Good hygiene. Teach proper toilet hygiene, especially in girls, wiping from front to back to reduce the risk of introducing bacteria into the urinary tract. Frequent urination. Encourage the child to urinate regularly and not to hold in urine for too long, as this can increase the risk of infection. Adequate fluid intake. Make sure the child drinks enough fluids, preferably water, to help flush bacteria from the urinary tract. Empty the bladder after urination. Encourage the child to fully empty their bladder when using the toilet to prevent stagnant urine that could harbor bacteria. Prevent constipation. Ensure the child has a healthy diet with sufficient fiber to prevent constipation, which can increase the risk of UTIs. Cotton underwear. Cotton underwear allows the genital area to stay dry, which can help prevent bacterial growth. Avoid bubble baths. Bubble baths or scented bath products can irritate the urinary tract and increase the risk of infection, especially in girls. Circumcision. In uncircumcised boys, keeping the area clean can help reduce the risk of UTIs, although circumcision has been associated with a lower risk of UTIs in infants. When to seek medical attention. Seek medical attention if the child has symptoms of a UTI, such as pain with urination, fever, or changes in urine color or smell. The child experiences new or unusual bedwetting or urinary frequency. The child has high fever, nausea, vomiting, or flank pain indicating a possible kidney infection. Symptoms do not improve after a few days of antibiotic treatment. Conclusion. Urinary tract infections in children are common but treatable with antibiotics. Prompt diagnosis and treatment are essential to avoid complications, especially kidney damage. Parents and caregivers should be vigilant for signs of UTIs and seek medical attention when necessary. Proper hygiene, adequate fluid intake, and preventive measures can help reduce the risk of UTIs in children.